I'm Sheriff Mike Reese, and I want to welcome you to the MCSO Public Safety Podcast. This month, we're joined by Dr. Jennifer Vines, our Tri-County health official. Our conversation today is focused on preventing the spread of COVID-19 and the use of face coverings and masks. Dr. Vines, welcome, and thank you for joining me in this important conversation.
Thank you. It's a pleasure to be with you.
So the first thing I wanted to ask you is, can you clarify the difference between face coverings and a mask, as until recently those terms were used interchangeably?
Sure. So I'll start with what we're now carefully referring to as masks. And I brought a procedural mask, which is a yellow paper rectangle with loops that go around the ears. And this is the kind of mask that sick people are offered as soon as they go into a healthcare system. And this is to put over their face and nose to contain any infectious droplets that they might be sneezing or coughing out. I also brought another mask, also called a respirator, which is an N95, and these are precious resources, so I have not unwrapped it, but you can see from this picture, it fits very tightly around the nose and mouth and creates a seal. And this is for healthcare workers who are doing very special types of procedures that can create a mist that can carry the virus on the mist. So these are really important for a fit test to make sure the seal is proper and is really reserved for those special medical procedures. What we're now calling face coverings are basically anything that people can find that will serve to cover their own nose and mouth if they can't maintain the 6-foot social distance, physical distance between themselves and other people. So for this, I brought what Multnomah County has issued to staff. This is an orange bandana wrapped around a coffee filter. It's the no-sew method, so you can see it has rubber bands, and the instruction sheet is very simple. I did it on my way here, and so this would just go over nose and mouth. Again, rubber bands loop behind the ears, and pretty simple.
It's a really clever design, especially if you're a Beaver fan.
Yes. Yes. I this was not my color choice. This is the county issued bandana.
I'm sure we'll be seeing some Duck fans in green, Beaver fans in orange. Well, the CDC recommendations have evolved during this crisis as we understand more about the COVID-19 virus. What are the latest recommendations for when to wear a face covering, when to wear a procedure mask, and when to wear an N95 mask?
Mm-hmm. So the procedure and N95 masks are really reserved for healthcare settings. Everybody else outside of healthcare settings is recommended to wear a face covering mask if they can't maintain that 6-foot physical distance as they go about their essential activities. So the face covering is not a replacement for staying at home. It's not a replacement certainly for being home if you're sick. And it does not replace good hand hygiene and maintaining that 6-foot separation from other people.
And for our public safety professionals and first responders out in the field, when they're coming into close contact with someone, member of the public, and they can't maintain that 6-foot distance, what would you recommend for them?
So if they can't maintain that 6-foot distance in an interaction, then a face covering that covers nose and mouth would be our recommendation at this point.
Great. Thank you very much. So one of the most frequent concerns we hear about is access to PPE, or personal protective equipment. Do we have enough procedure masks or N95 masks for our healthcare professionals and public safety professionals when they need to wear something that's of a better quality for protection?
Sure. So personal protective equipment is something that we're tracking really closely. Supply chains may be coming back online, but they're still unreliable. For now, we have supplies of most things, and people always want to know how long it will last. And I say that depends because our health systems have gotten creative in minimizing their use of personal protective equipment through conservation strategies, through reuse strategies, and through guidance that allows for disinfection and then putting those masks back into circulation. So it's a bit of a moving target between uncertainties in supply and some uncertainty in how much healthcare systems need at the moment. So I would say for now, the shelves are certainly not bare, but it's something that we watch very closely in the hopes of seeing a more reliable supply chain and more coming online.
So one of the best things that members of the public can do to help with this is to create their own face covering, wear it appropriately when needed, and not try and acquire more specialized masks that healthcare professionals are going to need.
Correct. The kind of procedural masks and N95s, we're really trying to set those aside for healthcare workers. And yeah, general public who can't maintain that 6-foot distance, any kind of face covering that is comfortable would be the recommendation.
So you talked a little bit about distancing already, but the language around distancing has changed as well. We now refer to social distancing as physical distancing. Have the recommendations for how much space is appropriate changed?
So we still talk about physical distancing as that 6-foot distance from other people who are not your immediate household or your immediate social circle. We're talking about physical distancing rather than social distancing because we recognize that people's instinct in uncertain times is to be connected to friends and family. And so we're trying to encourage those connections through creative use of phones, video calls, handwritten notes, and anything people can do to feel like they're still connected to their loved ones and friends, but maintaining that physical distance of 6 feet that we think is going to keep people safe.
And I asked you this a little bit before we started the interview, and it's just if you had that crystal ball, this has been an evolving situation, and it will continue to evolve, and there will be recommendations that change, and there will be new testing processes that come online in the weeks and months ahead. What do you think's next in that iteration?
Great question. It's the question right now. So we continue to plan for a potential surge that the most recent models have predicted for late April or early May. So I think there's reason to think we've been successful in slowing the spread of this virus in our communities, but we also understand that we have to prepare for months, 3, 6, 12 months ahead of now before a vaccine is widely available. So I think our thinking is planning on how we're going to use our tools that we have. That's lab testing. That's our public health role of identifying people with the virus and following up on their close contacts. It's protecting long-term care facilities and correction settings, which we know can be high risk for virus transmission. It's using new tools that we expect to come online around antibody testing that could tell us if someone has had the virus and is immune. So it's how do we put those tools to work and then slowly think about relaxing some of the measures that we've put in place around social distancing, and then keep a careful tab on how we're doing as a community with viral spread, making sure that we're protecting our most vulnerable, making sure that our health systems continue to function, and that we continue to manage this virus in a way that allows for people to get the health care they need when they need it, but also really tries to protect those at highest risk.
Well, you mentioned correctional settings, and I just want to say thank you to you and your team for your assistance in helping us develop protocols and policies to put in place to protect our staff at our correctional facilities, the adults in custody, and our deputy sheriffs and police officers that are working throughout the Tri-County area. We've literally taken your guidance on every single aspect of our process that we've implemented during this crisis, and you guys have been very responsive, and I just want to say thank you for that.
Well, thank you. I would reflect that gratitude back to you for taking this situation seriously, for protecting those who are in your charge and under your care, and for protecting our frontline workers who, again, I respect deeply, and I'm really grateful every day that they show up to work.
So is there anything else you'd like to share with our audience? The importance of some of the simpler steps that we take to protect ourselves around personal hygiene and things of that nature?
Sure. So a lot of conversations about face masks, about, is it 6 feet? Should it be more? I always get back to basics, which is the best things people can do are absolutely stay home if you are ill. And by that, I mean at the first sign of illness. So that might be just feeling unusually tired. It might be if you're someone who has an allergic cough every spring, is it worse or is it different from other years? And really staying home at the first sign of any symptoms. Similarly, hand hand hygiene. And if you are someone with allergies who says, I'm fine, I'm out and about, but you feel a cough or a sneeze coming on, do it into your elbow. Do really good hand hygiene. And again, we're in this together, even though it's affecting all of us differently. But just those really basic steps will go a long way.
Well, Dr. Vines, thank you so much for joining us today. This has been another edition of our MCSO Public Safety Podcast. My thanks to our guest, Dr. Jennifer Vines, and thanks to all of you in the healthcare and in public safety for protecting and serving our community during these difficult times. Stay safe out there.